When somebody is unable to do the rotation, we're looking to see if it is more related to a lower body, maybe potentially the hips, or an upper body in the thoracic or lumbar spine. So what we're going to do here is we're going to first have Bree go into hip rotation. So from this prone position, we're going to have her actively go into internal and external rotation and have her do this actively. Good, and then opposite side. And then we'll do it passively to see if there's any difference between what she can do actively and passively. We're also looking for asymmetries with this. So we want to have about 30 degrees of hip rotation. And if somebody's unable to do that, even if they have excessive motion on one side where they're 50 degrees on one side and they're 30 degrees on one side, if they're able to do that, because of that asymmetry, we would consider it unable. So we're looking for symmetrical hip rotation that is 30 degrees or greater. And again, we're checking active versus passive. For differentiating the upper body, we would go into a quadruped position. So in this quadruped position, we're going to have them put their hand behind their head and bring their elbow up towards the ceiling. And we want them to rotate without letting the trunk extend as they go into this position. Okay? So we're going to do this again, and sometimes I'll even say don't extend up too much into my hand, and then we'll check this passively to see if there's extra motion there when we give a bit of a passive overpressure. We're going to show you this from a different view here to see making sure that the trunk doesn't rotate up. So as we go into this position, and we would do this on both sides, and we're just looking to see if there's a limitation side to side and making sure that they're not elevating the trunk too much.